Welcome back, everybody, for another deep dive. This time, we're going to be looking into something you might not expect,
Yeah.
a possible connection between autism and pneumonia.
Right.
We've got some pretty interesting excerpts here from a couple sources.
Right.
Cheap ABA
Yeah.
is one, and the other one is a blog post called Autism and Pneumonia, Exploring the Connection.
Interesting.
So get ready for some really interesting insights
Yeah.
because we're going to be exploring some potential links between this and prenatal health,
Okay.
breastfeeding,
Yeah.
and even the challenges adults with autism face.
I think what's really interesting about this topic is that it's not just about childhood illnesses.
Right.
It kind of spans a person's entire life.
Yeah, so you might be thinking autism and pneumonia.
Yeah.
What's the connection there?
Right.
Well, a number of studies have shown a correlation between pneumonia and, ASD.
Yeah. And ASD is the full term
Right.
for what we're talking about, autism spectrum disorder.
Yeah.
And the research is ongoing, but the correlation is definitely something worth exploring further.
So is this just a coincidence, or is there something more going on here?
Right.
One area researchers are looking into is prenatal health,
Okay.
specifically the impact of infections during pregnancy.
Right.
We know that prenatal health plays a critical role in neurodevelopment.
Absolutely. It's a crucial time.
Yeah.
And what's really interesting is that studies have shown a heightened risk of ASD
Yeah.
in children whose mothers experienced these severe infections,
Wow.
like pneumonia during pregnancy.
One study even found a 79% increased risk
Yeah.
of ASD in children whose mothers were hospitalized with infections,
Oh,
like pneumonia during pregnancy.
that's a big one.
Yeah, that's a huge red flag.
Yeah,
It really underscores how important it is to understand how prenatal health
absolutely.
impacts the developing brain.
Yes, 79% is a significant increase for sure.
Yeah.
And, pregnancy is a complex process.
Right.
There are so many factors that influence a child's development.
Yeah.
But this finding really does emphasize the need for understanding
Yeah.
how maternal infections might be impacting that developing brain.
Now, on a slightly more positive note,
Okay.
some researchers believe that breastfeeding might actually play a protective role here.
Right. Breastfeeding has tons of benefits
Yeah.
for infants.
Mm-hmm.
One of them is supporting their immune system.
Right.
And some studies suggest that breastfeeding could help lower the chances of developing pneumonia,
Okay.
which in turn might reduce the risk of ASD.
So potentially breastfeeding could be a piece of the puzzle when it comes to protecting against both pneumonia and ASD.
Yeah.
This raises an important question, though. What about adults with autism?
Well, this is where it gets really interesting.
Okay.
Research indicates that pneumonia is actually a leading cause of hospitalization for adults with autism.
Wow, I had no idea.
Yeah.
Why might that be the case?
There are a few potential reasons.
Okay.
First, there might be some differences in the way the immune system functions.
Hmm.
In some individuals with autism,
Right.
making them more susceptible to infections like pneumonia.
Okay.
Another factor could be sensory sensitivities,
Ooh, right.
which we know a lot of autistic individuals experience.
Yeah.
Imagine how the feeling of a mask might make it difficult
Oh, yeah.
to wear one consistently, especially for long periods of time.
Right. And we can't forget about the communication aspect.
Absolutely.
Some adults with autism might have difficulty communicating their medical needs
Yeah.
or understanding the importance of preventative measures like vaccinations.
Exactly. And those challenges can make it harder for some individuals with autism
Right.
to advocate for their own healthcare needs
Right.
and put them at higher risk of complications from pneumonia.
So we've got this potential link between pneumonia and autism.
Yeah.
And it seems to be playing out at different stages of life.
Right.
But pneumonia isn't the only factor at play here, right?
Of course not. Autism is a complex condition.
Yeah.
And there are likely multiple contributing factors. Our sources mention a couple other interesting areas of research.
Like the idea that children with autism may have some differences in their airways.
Exactly. The Cheap ABA website mentions the possibility of abnormalities in the airways of children with autism,
Oh, okay.
such as double branching of the bronchi.
Okay.
So think of it like this: the bronchi are the airways that carry air to your lungs.
Okay.
In some children with autism, these airways might have an unusual structure,
Oh, wow.
almost like a double branch instead of a single one.
Okay.
And this could potentially make them more susceptible to infections.
It's like putting together a puzzle.
Yeah.
We're starting to see how these different pieces might fit in together.
Right. And another piece of the puzzle
Okay.
involves perinatal complications.
Okay.
Difficulties that occur during or shortly after birth.
Okay.
One potential culprit is Mycoplasma pneumonia, the
Right.
type of bacteria that can cause pneumonia.
Right. The blog post points that out.
Exactly.
That individuals with Mycoplasma pneumonia infection tend to have more perinatal complications.
Right. So while this doesn't directly link pneumonia and autism,
Right.
it suggests that factors influencing early development
Okay.
might play a role in both conditions.
This is all incredibly fascinating, but it also feels like we're just scratching the surface here.
We are just scratching the surface. There's just so much we don't know about autism
Yeah.
and its causes and
Yeah.
how these various factors all play together.
Mm-hmm.
But what is exciting is that
Yeah.
we do have this growing body of research
Yeah.
that suggests a connection between autism and pneumonia,
Okay.
a connection that definitely warrants further investigation.
So what does all this mean for our listener?
Yeah,
If there is this potential link,
right.
what can we even do with that information?
Well, that's the big question.
Yeah.
I think one of the key takeaways here is just awareness.
Right.
By understanding this potential connection,
Yeah.
we can be more vigilant about respiratory health. Individuals with autism.
And that vigilance needs to start early.
Absolutely.
I mean, we talked about prenatal health,
Right.
but, what about once a child is born?
Yeah.
What steps can parents and caregivers take to protect their child's respiratory health?
Well, for starters, making sure that children with autism receive all of the recommended vaccinations.
Right.
That includes the ones for pneumonia and influenza.
Of course.
Those are essential.
And we know that breastfeeding might offer some protection.
Hmm.
So encouraging breastfeeding when possible could be beneficial.
Absolutely. And as children grow, it's important to teach them good hygiene practices,
Right.
like frequent hand washing,
Of course.
to help reduce the risk of infection.
But as we discussed, sensory sensitivities
Right.
can make things like mask wearing challenging.
It's a good point.
What advice would you give to parents and caregivers
Mm.
in those situations?
I think the key here is patience and understanding,
Okay.
working with the child, to find solutions that address their sensory needs
Right.
while still promoting good respiratory hygiene.
Okay.
For example, maybe try different types of masks,
Right.
allow breaks from wearing a mask
Right?
when possible,
Yeah.
or use visual aids to explain why mask wearing is important.
And of course, open communication with healthcare providers is essential.
Couldn't agree more. Parents and caregivers should feel comfortable
Yeah.
discussing any concerns they have
Right.
about their child's respiratory health with their doctor.
Mm-hmm.
Early detection and treatment of any respiratory infections is so important.
Now let's shift gears and talk about adults with autism.
Okay.
We've seen that they're at increased risk of hospitalization from pneumonia.
Right.
So what can adults with autism do to safeguard their own respiratory health?
Well, a lot of the same principles apply.
Okay.
Staying up to date on vaccinations is crucial,
Right.
as is practicing good hygiene.
And advocating for themselves, right?
Absolutely. It's so important for adults with autism.
To feel empowered to communicate their needs to healthcare providers
Mm-hmm.
and seek prompt medical attention
Right.
if they're experiencing any respiratory symptoms.
It's about knowing the risks,
Yeah.
being proactive,
Mm-hmm.
and having those open lines of communication with healthcare professionals.
Absolutely.
Yeah.
And I'd also add that supporting research in this area is also essential.
Okay.
The more we understand about this connection between autism and pneumonia,
Right.
the better equipped we'll be to develop effective prevention and treatment strategies.
This has been a really insightful deep dive.
Yeah, it is.
We've covered a lot of ground today, but before we wrap up,
Okay.
I want to leave you with something to ponder. Knowing this potential link between autism and pneumonia,
Mm-hmm.
what steps could we take to better protect the respiratory health of individuals with autism throughout their lives?
It's a great question, and it's something that researchers, healthcare professionals, and the autism community are really actively exploring right now. We've uncovered some really fascinating insights today.
We have.
We explored a possible connection between autism and pneumonia.
Right?
We dug into the complexities of prenatal health.
Yeah.
We considered the protective role of breastfeeding.
Mm-hmm.
And we even highlighted the challenges adults with autism may face when it comes to respiratory health.
Absolutely. And throughout it all,
Yeah.
we really emphasize the importance of ongoing research,
Right.
awareness and open communication
Right.
between individuals with autism,
Yeah.
their families, and healthcare providers.
This isn't about jumping to conclusions or, causing alarm.
Right.
It's about equipping ourselves with knowledge and
Mm-hmm.
using that knowledge to advocate for better health outcomes
Absolutely.
for everyone on the autism spectrum.
Well said. Knowledge is power,
It really is.
especially when it comes to health and well-being.
Thank you so much for joining us on this deep dive.
It's been a pleasure.
We hope you found it as thought-provoking as we did, and as always, keep diving deep.